Okay, so just give me the situation. What's going on?
Okay, I've been having some real bad abdominal pain. Started earlier today, and I haven't really been able to get off the couch.
All right, I've arrived at the scene, putting my personal protective equipment on, and the scene is safe. It looks like there's one patient. The MOI is chest pain. Considering calling for ALS, uh, spine stabilization doesn't seem necessary. So, hi, I'm Zach. What seems to be the problem today?
Hi, I've been having some real bad abdominal pain that kind of started this morning, and I've just been laying around. I haven't been able to do anything today, so I finally called because it's just not getting any better.
Okay, have you hit your head at all today?
No, uh-uh.
Okay, so I'm still thinking that we don't need to stabilize the spine. My patient's main complaint is chest pain. The overall general impression is poor. Um, A on the AVPU scale because she's talking to me right now. Um, all right, so I can tell you're breathing because you're talking to me, but I'm gonna go ahead and check your respiratory rate.
Okay,
Here we go. The respiratory rate's 21. What's the actual respiratory rate?
24.
Okay, 24. The O2 saturation, looks like it's at 93%. What is it actually?
94.
Okay, 94. So we'll put a nasal cannula in, just to help a little bit. Does that seem to be helping at all?
Yeah, it does seem to help. Yeah, feeling a little better.
All right, that's great. I'm gonna check your pulse. There we go. So your pulse, I got a pulse of 80. What's the actual pulse?
110.
Okay, 110. So, do you have any bleeding going on?
No, no bleeding.
Okay, no bleeding. What's your is your skin is it pink and dry, or is it cool and clammy?
I feel kind of clammy.
All right, so it looks like our patient might be in shock, so we're gonna immediately transport them. Um, we're gonna keep them warm. We're giving them some oxygen. Um, so we'll move on to the secondary assessment here. Do you take any medications?
I've been taking a pain medication for a surgery I had a few weeks ago. It's been taking an opiate just twice a day.
Okay, sounds good. Have you had any issues with this chest pain in the past or abdominal pain in the past?
No.
Okay. Do you have any other health issues?
I have asthma, but it's pretty controlled. I use an inhaler just as needed.
Okay, sounds good. What was the last thing you ate today?
I ate lunch about 1 o'clock. I just had a bowl of soup. I didn't really feel like eating too much.
Okay. Um, so what were you doing before uh this pain started?
I haven't really been doing too much today. I've just been kind of sitting around, and then this pain started, and I just wasn't really able to move much. So haven't really been doing too much.
Okay, and where exactly is the pain at?
It's just kind of right in my stomach area. It's
So it's
sudden.
pretty concentrated, or is it radiating to any other parts of your body?
Um, it's kind of a stabbing pain, but no, not really. It's just mainly in that area.
Okay. Is there anything specific that makes it any worse? Any...
Um, when I get up to move it, it makes it's worse.
Okay.
If I kind of sit down and just kind of put pressure on it, it seems to help.
All right. How would you describe the quality of the pain?
Um, It's pretty severe. I'd say on a scale of 10 or something. Is that what
Oh,
you're want?
if you want to maybe just give, yeah, on a scale of 1 to 10, how painful
I'd
is it?
say it's probably like a 7 or an 8.
Okay. And it's been consistently at about a 7 or an 8 all day.
Pretty much for the last, I'd say 5 or 6 hours at least.
All right.
It could be better. That's why I finally called.
All right. So we're gonna go ahead and get our patient in the ambulance, begin to transfer them. So while we're doing this, I'm gonna palpate your abdomen. Um, when I do this, do I feel anything unusual?
Um, it's kind of tender,
Okay.
soft,
Um,
soft and
so now I'm gonna just auscultate for your breath and bowel movements. Do I hear anything unusual?
no, normal there.
All right, great. Um, so now I'm gonna lift up your shirt and expose your abdomen. Is there anything unusual that I'm seeing?
No,
Okay. All right. So now I'm gonna get a full set of vitals. So I checked your respiratory rate at
mm-hmm.
26, and your pulse was at about 120. So I'll check your blood pressure.
Okay.
Checking the blood pressure. It's 130 over 80. What's your actual blood pressure?
160 over 110.
All right. So high blood pressure. What is um so I'm not seeing any need to check for the glucose levels. My field impression is appendicitis. I don't see any interventions that we can take at this moment. So I'll call medical control just to see if they have any options or ideas. Uh, while we're in the ambulance, I'll repeat the primary assessment and take the vitals every 5 minutes because our patient is experiencing signs of shock. Um, all right, so now we've arrived at the hospital. So I'll give a run report to the nurse or whoever is taking over care. So our patient has abdominal pain starting about an hour ago, or about 5 to 6 hours ago.
Yeah.
He has pretty high blood pressure, high pulse. We haven't given any medication, but we've administered oxygen with a nasal cannula, and his oxygen level is uh, has gone up from a 94 to a 95.
Okay.
So it has helped a little bit. All right, that's it.
Alrighty.